Continuing Mobile Education for Emergency Medical Services Providers. Episode 2, Working with Healthcare Proxies in the Field. At the end of this episode, you should understand the concept of a healthcare proxy, understand how a healthcare proxy may change the course of care, learn how to identify the healthcare proxy, and describe how a healthcare proxy can assist EMS in patient care.
The healthcare proxy is somebody who's designated by the patient to make healthcare decisions on their behalf should they not be able to make decisions on their own. It's not always the next of kin, and the healthcare proxy should be designated by a state form.
A healthcare proxy is a person appointed by the patient to make healthcare decisions if the patient is unable to communicate their own wishes. This is not always the next of kin, and healthcare proxies must provide documentation to confirm their role.
I had a situation not long ago where I arrived at a scene and there was a gentleman that was quite ill. His daughter was there. She stated that she was his healthcare proxy. She did have the documentation, which was good because that's not always where the patient is. And it was important that we have that at that time. We felt comfortable that this had been discussed with the older gentleman as to what his wishes were and who was going to make those decisions in the event that he wasn't there. It's not always the case when we go to a home. Sometimes they say they have a healthcare proxy but don't know where the form is.
In the heat of the moment, it can be kind of difficult to determine who is the healthcare proxy. If the person has paperwork to support that, then the person can make decisions on behalf of the patient. As far as resuscitation, however, EMS should have the form available. The healthcare proxy should be able to present a form saying DNR if that is what the patient's wishes are. If that form can't be provided, again, local regulations may vary, but usually the medic would need to call into the medical director to get further instruction. Again, it only applies if the patient can't speak for themselves. In the pre-hospital setting, I would think a healthcare proxy would be able to refuse or accept transport, but again, it is generally, as far as resuscitation, which is what is applying to the EMS community, they really need to be able to produce a DNR form. They can't make that decision without the documentation. They can refuse care for a patient, again, except for resuscitation, in which case, if they can't produce a DNR form for the patient, then again, they would need to call medical control. A healthcare proxy can always rescind the DNR status. If somebody is DNR, they can overrule that. Even though that would go against the gut instincts of the caregivers, they do have to honor that. And again, the important thing to remember is the healthcare proxy's decision-making power only kicks in if the patient can't speak for themselves.
I sometimes oversimplify things, whether it be a healthcare proxy from New York State or from out of state or whatever. I think that it's best to get medical control involved. That might not be the best answer, but for me, I like to keep it simple. And if there's a healthcare proxy and I believe that that's going to affect how I'm going to treat the patient, especially in a CPR scenario, then I'm going to talk to a medical control physician and try to take it to a protocol where I'm dealing with another physician one-on-one and not so much, like you said, the lack of paperwork or the lack of proper documentation as to what the family and the physician had decided should be done. Yeah, I don't know much about the Florida healthcare proxies, but I ended up running into a situation once where there was a healthcare proxy established in Florida. Person was visiting or basically setting up residence here in Rochester, and it ended up being some confusion as to the healthcare proxy in Florida matching with a DNR here in New York State, and the family was very much convinced that that was an equivalent. Me not knowing the law as well as I probably should have as how Florida goes, I ended up talking to medical control, as I suggested earlier, and they ended up honoring it, which I was very comfortable with, but before talking to a physician, I wasn't ready to make that call. Well, the last case that I just mentioned would probably be the best, but I've also encountered situations where there was a healthcare proxy established and different members of the family arguing about how that should or shouldn't be executed. Had that a couple times, and I usually default to talking to medical control. That is something where I'll try to discuss it with the family there, but in an emergent setting, I don't really have time to get them to resolve things, so I'll end up having a physician make the call and just give them, the physician, whoever it is on the other end of the phone, a lot of good information, but just let them make the call.
I have been in situations where there have been DNRs, do not resuscitate orders, completed, and healthcare proxy forms as well. Those forms were not where the patient and the family was. And there have been situations where there may be two family members that disagree as to the course of events in the event the patient's not able to talk for themselves, and there has been conflict. So we do our best to educate people that if they do fill those forms out, they need to understand what the patient's wishes are and try to stay consistent with the patient's wishes.
Work with the proxy to ensure the patient's treatment wishes are being considered if the patient cannot communicate those desires. The proxy may revoke the patient's DNR status, and if there are questions about working with the proxy, contact medical control. After watching this episode, you should understand the concept of the healthcare proxy, understand how the healthcare proxy may change the course of care, learn how to identify the healthcare proxy, and describe how the healthcare proxy can assist EMS in patient care.